Welcome to the Next Steps to Leadership with your host, Dr. Stephen Oliver. In each episode, we invite experts to share their passion and their leadership journey to help you in your next steps. You can find this show on YouTube, LinkedIn, Apple Podcast, Spotify, and on our website, hrcvision.com. Now, here's the host of Next Steps to Leadership, Dr. Stephen Oliver.
Hello, and welcome to the podcast, Taking the Next Steps to Leadership. As mentioned, I'm Dr. Stephen Oliver, or Dr. O. The purpose of this podcast is to give some tips, techniques, and some advice to younger and newer managers who are up and coming. I invite senior leaders, people from training and development and learning, human resource management leaders, nursing leaders, some folks who own their own businesses, academics, and consultants to come in and just talk a little bit about their career, the successes they've had, and the challenges and opportunities that they face. So I'm really excited to have my guest today, Dr. Jackie Raab. Very glad to have you. Let me just tell you a little bit about Dr. Jackie Raab. Dr. Jackie is a clinical director of primary care and population health at what's called Penn Medicine. This is the University of Pennsylvania health system in Philadelphia, Pennsylvania. Jackie is an advocate for access to high quality care, enhancing the patient experience. She has a strong foundation in nursing, and she's dedicated to improving patient outcomes through compassionate and innovative patient-centered care. And we're going to talk about that. Jackie has a deep commitment to ensuring that healthcare is accessible, equitable, promoting policies and practices, and prioritizing and well-being of the patients who come to the University of Pennsylvania. Her passion as a nurse leader is creating a healthcare environment where quality care and positive experiences are the standard for every individual. Dr. Raab also holds a doctorate of nursing practice from the University of Pennsylvania and a master's in nursing from the University of Pennsylvania. So welcome, Jackie. So great to see you today.
Thank you, Dr. O. I'm really happy to be here.
Yeah, so let's just start out. The topic, what you're going to impart to folks today is kind of unique, and I'm really excited about this discussion today. You're going to talk a little bit about your leadership journey in nursing, and then just some of the things that you experienced and learned, and how those can help younger and newer leaders in their careers, whether it's in nursing or any other type of career. By the way, this podcast is also designed for those who are later in life, mid-career, later career. And we're always changing, careers are happening and moving, and so anyone can learn from this. So Dr. Raab, what are you up to today? What are some things that you're doing today? That's a loaded question.
Yeah. Well, aside from, going back to school, as you know, recently finishing that program, raising my 3 and 6-year-old in Philly with my husband and our cat. So it wasn't an easy task, being in school, but definitely loved the opportunity to always be, learning. And now I have more time to spend with my family in the city.
Well, that's great. I mean, actually, we met in several years ago. Now it's been more years than I thought. We met in when you were in your master's of nursing. You were actually in my class, my human resource management healthcare class. And you were one of those students who always answered when nobody else would. And you were always there to take on some of the conversation and challenges. And I just really admired you. And I am so honored in my career because I have quite a few students over the years that I form a bond, a relationship, a friendship, a collegial connection. I've come into your organizations and done some training and development, and then you've come to some of my classes and imparted your knowledge about being, within, administration, human resources, and what it's like as a nurse, because you're moving away from the bedside in that role. Do you mind just telling us, Jackie, a little bit about what prompted you to go back for both your master's of nursing and your doctorate of nursing practice, what prompted you to go back to school?
Sure. So I would, kind of more recently talk about my doctorate. So when I started my now current job, that's also when I started my doctorate program at Penn. So, it's actually getting, pursuing higher education and getting, higher degrees in nursing is pretty common amongst nurse leaders. And it was always an academic goal of mine. So it kind of felt like the right time, new endeavor, and then also taking advantage of, going to school and, taking that new step in my leadership journey. With my master's, that was also during a time when I was in a, somewhat new management role in my previous job. And, that was an opportunity for me to really connect with other, nursing leaders and, have the opportunity to, be in the space that you provided in your courses, really, enhancing what leadership in nursing, means. And it's not just, budgets and work at the bedside, but things like, human resource needs and expectations, as well as, what are their expectations for nurse leaders in, a large medical center.
That's great. And do you mind sharing just briefly about what your research project was in your doctorate of nursing practice? What did you study as the final
Yeah.
outcome?
Yeah, that's a great question. So I spent a lot of time working with our regions across Penn Medicine, and we have many regions that are not in the downtown area; they're out in the suburbs. And we oftentimes have patients that have diabetes and uncontrolled diabetes that if we're not seeing them or we're not, getting labs on them regularly, we can oftentimes, lose that ability to monitor them. And so I worked with the team in one of the regions and their clinicians and their leadership to create a standard approach to point of care A1C testing. So it's essentially having an analyzer that the practice is invested in. So, it's not a cheap tool, but to actually have a standard process where we're capturing those patients that either are overdue for their A1C. So this is some of our preventative measures that we want to make sure that our patients are, getting their annual A1C, or if their A1C was greater than 8 or 9, depending on what insurance company, sets certain targets. And really what we were able to do was set that process that when patients came to the clinic, we had a both utilizing our technology, but also utilizing the EHR to capture those A1Cs at the practice. And so what we saw was that there was a pretty high completion rate after doing that training education. And we've seen sustainability there and have been able to scale that process across many regions. And it seems like a simple task, but to actually put evidence-based practice into practice, sometimes some extra time. So it took me, a couple of years to get that project, up and running. And it's really great seeing it getting scaled, across the regions as well.
Well, that's fantastic. That's such a great contribution to healthcare and nursing, because unfortunately, diabetes is a growing disease throughout America.
Yeah.
And so it's so wonderful that you got to create that project and see it still living today. So
Yeah.
very interesting. And thank you for sharing that with us. So I wanted to just kind of move a little bit into your career in leadership. And what are some of the things that you've learned so far? I mean, again, that's a pretty broad question, but what are some of the things you learned in your journey so far?
Yeah. So as I prepared for this podcast and listened to some of the other speakers, I figured I could gear this interview toward younger or even newer leaders. So kind of to your point in the beginning, it doesn't matter. You might be in the workforce for a long time and then they take on a new leadership role, but we have to navigate as newer leaders or even younger leaders that there are different workforces, especially if you work in healthcare, different generations, different cultures, lots of diversity, and how do you create your own path in those environments. And so that I think, for me, over the years, it has been a really important learning experience for me that as you are able to work with different workforces, it's not necessarily that there's hierarchies, you work with physicians and frontline staff, but how do we navigate with all these different people and creating your path as a leader, and being authentic in that leadership role. So, looking forward to kind of talking through that a little bit more here.
Yeah, and I've had the honor to observe you work at several healthcare systems here in Philadelphia. Philadelphia is unique in that we have 4 major health systems within the city, and then across the river in New Jersey is a health system, and then about 45 minutes below us in Delaware, Christiana Care. So we got lots of health systems here in the Philly region. So one thing I wanted to just kind of circle back, you talked about going back to school and getting your master's and then your doctorate, but you also are doing a lot with certifications and continuing education. As like many different careers, nursing has a requirement of doing lots of current certifications. Can you tell us a little bit about some of the certifications you have and your impetus for continuing to do that?
Yeah. So when I was in my master, or actually I think I had completed my master's program, I was working in a specialty in my first management role. And basically what I saw was there was an opportunity to kind of gain some knowledge around quality improvement. It was such a buzzword, as when I was in grad school, but what does that truly mean and how do you make that impact, especially when you're working in an environment where there's a lot of academic medicine and a lot of data. And so at the time I had completed my Six Sigma Green Belt at Villanova. Actually, they have a healthcare program. And I really did that to support the work that I was doing in my role at that time. And, it was kind of an extension of after completing my master's degree. It's always, again, same thing with nursing, getting certified or having some of those additional specialty trainings really help, the work that you're doing in the environment that you're in. And so when I did this certification, I actually worked with some of my esteemed physician colleagues, and we were published a few times. And it was really, a great experience. But what I also realized, you can go and get education, you can do all this training, but it takes a lot of patience and it takes, work, of course. But I think, during all of those transitions of getting education, getting new jobs, educating yourself, you're kind of overloaded with information. There's really, I think, an important piece of having that balance and understanding that you need to give yourself grace through a lot of these trainings and education opportunities. And so I think that one of the big reasons why I was going back, constantly, aside from being like a forever learner, was to, be able to accomplish certain goals, my own internal goals that I felt, this would give me that advantage to be able to take take my nursing hat off, put on my quality hat, take my quality hat off, put my manager hat on. And so it gave me a little bit more of that flexibility of being able to, speak the language in different ways. So yeah, I definitely recommend if people are interested in like understanding how to do any formal like process improvement, quality improvement, there's a lot of really great programs out there where you can work on getting your green belt and you can go up to black belt.
Yeah, very fascinating. And quality is so important in healthcare. I mean, as I mentioned, we have some major health systems here in Philadelphia. We have the, Penn Medicine where you work, and then right next door is the Children's Hospital of Philadelphia, Temple University Health System, Thomas Jefferson University Health System, and Drexel University Health System. I'm mentioning these because I'm curious, what is it like to work in a research facility? Because you mentioned the influence of physicians, but there's also other nursing leaders and leaders of other types of sciences. So what's it like working with them in these health systems?
Yeah, great question. So my career has always been in academic medicine. I worked at both Jefferson and Penn Medicine. And I'll say one big piece is it's very inspiring to be able to work alongside, people that are making, real changes, whether it's through research, whether it's through patient care. That has been, I think, incredibly inspiring to me as a nurse that, started at the bedside at one of those downtown hospitals to now being able to actually work alongside some of these leaders, whether they're physicians or, advanced practice providers or other types of administrators. It's great to see kind of experts work together. Sometimes, it gets there's a lot of chiefs in some of these
Right.
environments, right? But at the same time, we really pride ourselves at Penn, kind of being that Quaker organization, governance models, having, opportunities to discuss things in a group setting. It really, I think, gives a lot more clarity around why we're doing this work, because we always have, mission based off of what our organization, is values. But when you're able to actually work in these environments, you get to see some of that progress. We do a lot of publishing, as you can imagine, but even attending conferences. Like I had a poster at the Nudge Unit
Right.
this past year, and some of my colleagues were even, on panels or leading panels that I work alongside all the time. So it's great to kind of see that full circle and be, amongst some of those really, like-minded people is how I would describe it. That, the intention is really to ensure that, kind of, as you had said in the beginning, get patients the care that they need at the right time. And so when you have that, kind of behind the scenes research and academics and even students, residents and medical students and nursing students all kind of involved, it really allows for great work to be done that you maybe wouldn't see in smaller settings, that they just don't have the resources or they don't have the people that have time, to do this. So I really value the fact that we have so many of these kind of institutions locally. I think we're really fortunate. I remember in my previous role, we had patients traveling from other countries and other states to seek care locally. And so, it's just great to be a part of that. And like I said, very inspiring. And it's always motivated me to, want to make that impact as well.
Well, thank you for clarifying that. I think a lot of people know about the good healthcare that's delivered by these organizations, but just to know that there's so much more involved in research. And as you mentioned earlier, quality, and there are such passionate people who work there, and they're doing so much more than just basic healthcare delivery. So that's really important to know. Another thing that just came up as I was thinking as you were talking, do you mind just telling us a little bit more about your role? It sounds very interesting, but I would just like a little clarification. Clinical Director of Primary Care and Population Health at Penn Medicine. Do you mind just telling us a little bit more about what that role is?
Sure. So I describe it as like a corporate service. And so in such a large organization, we have a lot of, I would say, like competing priorities when it comes to our population. So we work in a payer agnostic fashion. We are not, payer driven. We take care of all of our patients regardless, how they present, whether they, have certain insurances or not. And, that in itself allows for a lot of confusion. Just in general, a lot of people they don't really know the ins and outs of how we get paid for our care and what services are rendered. It's usually when you're in the thick of getting that care, you're, exposed to it. And so in my role, I support all of our primary care practices across the network and all of our population health services. And so what that means is that we have basically central resources that support all of our practices. So I have partners in my team that run our Pop Health program, where they have team members that help with closing care gaps in care. We have another team member who runs our care management, and that's a team of like nurses and pharmacists and social workers and behavioral health. And my role is really to help integrate programs, lots of practice transformation. And I spend a lot of time working with practices and practice leaders on implementing best practices into their clinics. With my nursing background, obviously, I can speak a lot of the language, and I understand, how patients' illnesses, come about, and then managing them, and also ensuring that we're offering preventative services. So a lot of my role, we talk about wraparound services. So that basically is, inreach and outreach. And so inreach is when patients are in the system, in the health system, at a doctor's appointment or, in the hospital, that's inreach. What services are we offering to them? Oh, you're due for your flu shot. Oh, you're due for a wellness visit. Oh, you're due for HPV vaccine. You're of a certain age. And then outreach, and that's when patients are out of our system and we're reaching out to them and saying, oh, we need to see you. We haven't seen you in a year. You're due for, another colonoscopy because you're of that age. And so working with that team to ensure that we have all those kind of dots connected, that our patients then are receiving the care, the right time with the right person, at the right place. With that being said, a lot of my role also supports education. So, kind of back to, who I am as a person, but how do we bring that education to our front line, whether it is, front desk staff or clinicians, and everybody in between. And so I offer all sorts of different, opportunities for our team members. So every 2 weeks we have a CME series. It's like a grand rounds. We have all sorts of different topics. It's very, I would say, productive in the sense that we allow for Q&A, we record those sessions, and then people get credit. And it's for physicians, APPs, nurses, and pharmacists. I also have a newsletter that I send out every month. That's kind of like the need to know across the network, which goes out to like thousands of people across the network. But again, it's like giving people the information that they need. There's a new documentation update, for our HCC coding. We want to make sure that we have that, available so people see that when, BPA fires, we have that, opportunity to educate them. So there's a lot of kind of those pieces where I help connect the dots. And again, from like a programmatic standpoint, really helping get some programs up and running. So for those that know the population health world, we have some value-based programs that we're involved in. And we actually just started an accountable care organization and really getting that program up and running. And so it's a lot of data, it's a lot of operations, and it's a lot of, connecting the dots again with, patients, and then the information that we have in our electronic health record, and some of that, ability to translate those data points to dollars. And then the last piece from an education standpoint is I spend a lot of time working on patient experience at our system. And I've led many, many sessions around patient experience. We have lots of different projects, kind of alongside with that. And with some of those patient experience sessions, I also run a quarterly directors collaborative with all of the different directors, both clinical and operational, across the network. And we meet in person and we have virtual sessions where we do things like goal setting, certain topics that we've brought forward that have really allowed for our directors to be collaborative, kind of working together more as a team. But again, bringing that best practice to our leaders so that they can then take that information and start to implement it across their practices as well.
Wow, I'm kind of exhausted by hearing all that. I mean, what a critical role of combining information and patient experience is so important to healthcare. One thing that a lot of people who are not in healthcare may not realize, patients have choices like other consumers, and if they're not happy at one health system, they can go somewhere else. So healthcare and hospitals are constantly looking at that, and so much education that you're doing there, and reminding and communication. Fantastic role. Thank you so much for clarifying that. Now, I wanted to just rewind a little bit back to your RN days, and if you can talk just a little bit about flexibility, because that's so key in being a nurse and in some of the things that you've done. Just talk a little bit about that, if you don't mind.
Sure. So yeah, I'm one of those people that will always bring up, kind of stories, right, of things that we've gone through. We know that that's oftentimes more impactful when we're, working with certain team members. And, one thing as that I kind of think about when I first started working as a nurse at the bedside, so I worked in one of the downtown hospitals, is that, you have to be flexible. Some of that might be, days that I would have, I'd be covering both neurology and neurosurgery patients. So I have to work with, the covering medical team, the covering surgical team. Sometimes you come in and you have we would call it like a heavy patient assignment. And so, patients on ventilators, different, drips and drains, and just, might need complete care. And you have to kind of learn to be resourceful, and you have to know how to be agile, in these environments. And so that was kind of like how I had started my nursing journey. Was, it wasn't just like, here's your, patients, everything's happy, easy. It was very much every day you walk in and it's something different, right? So then you fast forward, and when I, started to move into a leadership role, I had to be more flexible with managing, multiple responsibilities. So, supplies, for example, or staffing or budgets, some of these competing priorities, your patience starts to get tested, right? Because you're trying to recruit staff, but you're also, over budget. And so how do you manage that? Or you need supplies and, there's some shipping issues. And so how do you manage, your own ability to be flexible, but also to be, patient, right? And then really in my current role, having the opportunity to collaborate with different stakeholders, and to support our initiatives, some of our, best practices that we're trying to implement, the new programs. I think as somebody that went working as a nurse to then is in a leadership role, I don't really practice as a nurse anymore, but going into that transition, what you have to really realize is that it takes time. So it doesn't happen overnight. You have to be flexible. And then really, if you want to create lasting change, you have to make sure that the progress that you make is sustainable. And so I think oftentimes, if you want to be a strong leader, you have to have courage to be accountable. I always say I'm pretty authentic as a leader. I think, I'm going to kind of go into times that you remember. I think one of the most challenging parts of being a nurse leader was, when I had to performance manage people, and terminate employees. And I think one of the challenging parts that I didn't expect was that many of these people were older than me. And just even going through the process of performance management or performance improvement, that's painful. And, if you're successful, that's great. But oftentimes, that doesn't necessarily happen. Maybe the employee leaves or, they don't improve. You have to, take other actions. But really, at the end of the day, for me, I was trying to do right by the organization. I was trying to, support the staff being productive, professional, work to ensure our patients are receiving that quality care. But, all that sounds great. But what I learned was that, some of it is generational. Sometimes people don't want to change, right? But then we really, as a nurse, I always say, I put that hat on and I take it off. But as a nurse, I always think about how does that impact the patient care? It's not about the people, you have to kind of be able to separate and say, okay, right now I'm thinking about the care that's being, provided. Okay, now I'm thinking about the employee and, their, ability to perform. And it really tested a lot of my own patience, my own flexibility. But it allowed for me to also understand all those dynamics that impact how we operate, and especially healthcare organizations, is that so many different people, different generations, different backgrounds, different, work experience. And so it's not just one size fits all. It's, being able to really work with the people that you have. And I think for myself, understanding that change is hard, but it takes time. And that I was like, okay, I think I can keep doing this.
Right. Well, some great tips that you have given in that question I asked about, being flexible, taking a risk and taking courage, the accountability to have to go in as a younger manager and work with older nurses and having to, hold them accountable to performance. And then some had to be terminated. And you're right, it's about change. That change happens in healthcare, and not everybody can accept that. In my career, I have worked with so many nurses of all generations, and they're all so passionate. But just the approaches of a baby boom nurse versus a millennial nurse can be very different to the bedside, the patient. So it's great that you, gave us those tips and, had that experience. One other thing, Jackie, I wanted to highlight, I noticed this about you is, your commitment to professional development for your staff. And you brought me in to do a seminar on professional development, emotional intelligence, but you continue to do that. Do you mind just telling us a little bit about, as a leader, why you were invested in professional development for your staff?
Sure. Yeah. So, and that was such a fun time. And I really, that was really, I think, a special opportunity for us to be able to bring kind of external forces together to really make an impact on the team at that time. So, always will remember that partnership with you. I would say from a professional development standpoint, I always felt that when I had somebody that advocated for me, whether it was like in my role or professionally, or, academically, it then kind of created opportunities for me to grow as a leader, and, be a better nurse and a better leader. And so I think because it was something that I always valued, in my experience, I wanted to really give that back to my own team, at that time. And, you had suggested, kind of that emotional intelligence work. I'd spent some time, working with them around the strength finders trainings, because that helped me in my career. And I felt, give that, pay it forward, kind of approach, in a way that made sense. I think this kind of, thinking about this, it's been kind of my own personal philosophy now to really continue to develop myself. So, like I said, I had so many people support me and encourage me through my journey, and being able to encourage others, whether they're, my own direct reports or people that I work with, to develop professionally, it really, I think, allows for us to feel like we're making kind of a bigger impact than what we're doing day to day, right? It's something kind of you're working on behind the scenes, and it really helps you as a leader, as a professional, to have access to that best practice or those best nuggets, as I describe them, that you can bring to the table that otherwise people would never be exposed to or have the opportunity. And so I remember just thinking about it when I took this job. I remember my boss at the time said something along the lines of, you definitely have knowledge around some of those Lean Six Sigma tools. And because I kept using them, and it was just, part of my nature. And I really started to see how when you can take some of these tools that you learn, and that's just one example, but some of these tools or these, activities or ways to tackle and approach your work, it develops you. And, it's not just the same thing. Okay, I'm coming in and I have to deal with the patient issue. Let's be a little bit more innovative. Let's think a little bit, more outside the box. And what can I take from that training or from those other colleagues, and bring that to my organization. I did also do, I just realized I didn't mention this. There's an organization, Sentinel, that is a society for nurse leaders and entrepreneurs. Right. And I did a training with that. It was more so around like innovation. And they described it as being an intrapreneur in your organization in some of those instances. And I felt that was very motivating because we met a lot of different leaders who had gone so many different routes in their own development. One person, left the bedside and created her own company. Another person, created an app for people to use. And so you kind of, if you don't put yourself out there and take those steps to kind of grow yourself, we'll never really see what you're able to accomplish. And so I felt, after many years of, having that, opportunity to grow and develop myself, and I continue to do so, I really feel like we have to be able to pay it forward and offer those opportunities, to those that are, working alongside us.
Well, that's great. And this is one thing that I've learned so much about nursing is there's so many societies and organizations, subsets to join. And it's really critical, whether you're a nurse or in another field, is to join an organization to hear new current information, ideas. And I also love the fact of this intrapreneur, being an entrepreneur, but within your organization.
Exactly.
And the University of Pennsylvania School of Nursing does so much around innovation. Well, University of Pennsylvania, period, does in all the different disciplines.
Totally.
So those are some great tips. Our time is going so fast. I wanted to know if we can, again, come back to the current, and if you could talk just briefly a little bit about Penn Medicine or the University of Pennsylvania health system, and then the collaboratives that you're working on. You mentioned that earlier when you described your job. Do you mind just saying a little bit about both of those?
Yeah, sure. So those that, either have experience working in large academic medical centers or some of these larger systems, we are doing a lot of integration. There's a lot of practices and hospitals that are now basically being taken over by some of these larger systems. It's generally positive where we kind of bring them under our umbrella, but the transition is challenging. They might not be on the same EHR. The providers maybe were very just independent, and now they have all these resources available. And so that's kind of one piece, is that we're constantly growing. And how do we kind of maintain providing the same care from South Jersey to Princeton, so that's kind of one piece, is we're growing very fast, and we see that across, many, many networks. The second part of it is that we are an institution that patients come to us for that tertiary care. They come to us for that primary care. They come to us for many, many services, and there are patients for many years, especially if they're primary care patients. In our specialty practices, oftentimes, they see us for a certain period of time and then, don't need that service anymore. But it's really important to kind of understand that we are here to serve our communities. And as primary care providers, it is our kind of responsibility to ensure that our patients are receiving the right care, that we're, offering them the right care and the safest care and the highest quality care. But it's hard to do that when you're, short-staffed or a new provider to the system, or, all sorts of impacts that can, deter you from being able to provide those services to our patients. And so part of our strategic planning in the system was to see how we can get our leaders across our regions to work closer together. Things like setting goals every year. We have fiscal years, we have calendar years, but setting goals, whether they are related to our quality measures or operational goals. But that's always an opportunity in those quarterly collaboratives that I have with our directors, is to have those discussions. And so, maybe out in Lancaster, they may have already, done a lot of really great work with lead testing. And we need to improve our metrics in some of our community practices. And so how do we set some of those goals there and reach those goals? The other part of it is we have brought so many different topics to those collaborative sessions. We've had, different speakers, whether it was around financial acumen, to really allow for our leaders to ask questions and also learn how funds flow works, in the organization, to things like conflict resolution, and having, opportunities to learn from experts and work together. We also in these sessions have teamwork, kind of activities. The last session we had was around template optimization and how do we prioritize our patients that come in. So new patients, sick patients, wellness visits, post-hospital visits, and really what are some of those best practices. And so we had, our teams broken down randomly, not in the same regions, and work together on like a week's worth of a schedule. And then what are some of those best practices, and how do we start to really spend more of our efforts around our patients that need more of those resources. So patients that were out of the hospital, are we capturing them? Are we making sure that they are getting all those resources so they don't land back in the hospital? So that's, some of those examples. Really, those directors collaboratives are to foster learning, promote best practice, and like I said, enhance teamwork. And as I mentioned, also, I lead those biweekly virtual grand rounds. And those have really, I think, provide an opportunity for us to have our internal and academic partners lecture on topics. And, we have one coming up on suicidal prevention strategies, to cognitive assessments, to how to document annual wellness visits appropriately and capture our patients and bill, in a way that makes sense and, really gets our patients coded in a way that we are capturing their illnesses and also offering them services to manage their health. And so it's been a really interesting, I would say, evolution, because it was something that we didn't really realize was needed in the organization until we started to put those resources out there. And a lot of people are using, the recordings of some of these education sessions, the director collaboratives. We have folks working on projects between those collaboratives, right? Because a lot of information sharing and ideas came out of those collaboratives. And so there's, performance improvement projects and, other initiatives that are, being put in place between those meetings. So it's really, I think, a great way to hone in teamwork and also collaboration. And Penn, I think, Penn, University of Penn, the nursing school, their philosophy is really around evidence-based practice, and evidence, right? And so it's the perfect environment to allow for that, and really encouraging long-time learning, for our team. And so those of us that are licensed professionals, we have to, continue education, right, to maintain our license. And so how do we do this in a way that makes sense? And that's really kind of how some of this has evolved.
Well, really interesting and fascinating. And so much of what I've learned just in our conversation is, there's so much more to nursing than just bedside care. And it's really important to weave in quality metrics, data. So much of it's data driven, and then the education. So our time is winding down, and I just wanted to ask you one more question. Any final advice for new leaders, new nursing leaders, or just new leaders in general? Any final things?
Yeah. So, I've always been very authentic when I've worked with people. And I think it's really important to build those relationships and trust, as we're working with our colleagues. I think, some advice is, we all have egos. We're all, concerned about our reputation, our pride. And oftentimes it clouds us. And I think, similarly, internal pressures we get from our organizations, we can feel defeated at times. And I always say, if being a leader would be easy, anybody could do it, right? But doing it well is what really sets you apart. And so same kind of thing as we discussed before, keeping that open mind, being accountable, being flexible, will really allow for you to be the leader that you want to be. I also think just kind of one thing that we talk about a lot, but it's not necessarily at the forefront, is I also think, especially in healthcare, staffing is, the forefront of our conversation. It's the most expensive, labor costs. It's a huge operational expense. But we also, our staff is our most valuable asset, to our organization. So, I think it's always been a strategy of mine. And if I were to give advice for future leaders, is to really work toward optimizing your staffing levels and the productivity. And so we're making sure if you have clinical staff, they're working top of license, providing them that continuous education, training, competencies, opportunities to advance is super, super important. And I think, from a financial standpoint, really understanding how the finances work. So, sit on that budget meeting. You might not have a budget that you're accountable for, but listen, understand how they're even budgeting for next year. And, I always say, take an Excel class or, sit on a new training. I just did this organization for nurse leaders training that was offered on financial acumen that I just, needed a refresher. And so I was, okay, capital budget versus, a different type of budget. All of that is really important to understand. You might not be accountable for it at the time, but just to be able to understand how the business works will really help you with your staffing, will help you with your own productivity, and then ultimately, hopefully provide, that expert care to the populations that you're serving.
Well,
and ask questions, lots of questions.
Right. Staffing is one of the number one challenges for nursing, no matter what. And then I love your advice on learning and understanding and knowing finances. So important. Well, thank you so much for coming today. Dr. Jackie Raab, Clinical Director, Primary Care and Population Health at Penn Medicine, or the University of Pennsylvania Health System, who is an ongoing advocate for well-being of patients, Doctor of Nursing Practice, Masters of Nursing Science. Thank you so much. It's been great, and I look forward to continued collaboration, friendship, and seeing your career continue to go. So thank you for coming today.
Thank you, Dr. Oliver. It's a pleasure.
And I want to thank all of you for coming to the podcast today. If anyone needs any assistance in taking the next step, I'm here to help out. Dr. Stephen Oliver, Dr. O, my consulting HRC vision, which is learning, leadership, and human resources. And then if you have any further questions for Dr. Jackie Raab, please feel free to contact her. So thank you very much, everybody, for joining today.
You've been tuning in to Next Steps to Leadership with your host, Dr. Stephen Oliver. You can find this show on YouTube, LinkedIn, Apple Podcast, Spotify, and on our website, hrcvision.com. Thank you for your positive feedback, comments, questions, and for sharing this show with others.